So let's begin our lesson. Yes, today it is Unit 1, Lesson 3, Week 3 of our brand new full year of learning. This unit is the basics. We're going to be talking about a lot of the foundational stuff. We'll be talking about basics. We talked about sleep health, and we'll be talking about breathing today. And then next week, we will put our breathing practice to use in a guided meditation session. We got to talk about what breathing is first, right? What is breathing? Well, I mean, obviously it's inhaling and exhaling. The scientists describe it as the rhythmic process of moving air into and out of the lungs, mostly to flush out carbon dioxide and bring in oxygen. But what does that mean for us? Well, this is what it looks like. This is what it looks like, which kind of looks kind of gross. It just means that we're bringing in oxygen and releasing carbon dioxide. Because we need oxygen for our energy. Our cells and tissues need oxygen. And we need to balance our acid and base. And bringing in oxygen and relieving CO2 does that as well. But, you know that we're not really here to talk about all the anatomy and physiology of it. That's not usually what we do. We're more focused on the practical skills. So we could talk about all these parts of the respiratory system. The lungs and the throat, the nose. We could talk about the alveoli and the gas exchange. But we're not going to focus on that. We're not really going to talk about all of that stuff. We want to focus on something much simpler. The fact that we breathe too fast, and the fact that we breathe too shallow. Normally, adults should be breathing about 12 to 20 respirations per minute. Now 20 is a bit high, but if it's between 12 and 20, that's considered normal. That's what a doctor would say is in the normal range. It's why when we do our normal breathing exercise that we do before every other lesson, when we take 3 deep breaths in 1 minute, we say, normally we breathe 4 or 5 times faster than this. But sometimes much faster. Sometimes 6 or 7 times faster. What does that do to us? I think 20 respirations is pretty fast. Well, what's normal for you will be different from everyone else. But what's normal means that you're taking in oxygen and relieving carbon dioxide at the same rate that it's produced. And welcome, Safecracker, first-time chatter. You already had 2 cigarettes waiting for the stream to start. Yeah, we'll be doing lung health. But we'll talk a little bit about smoking. It's okay, though. I used to smoke as well. Not for very long. I thought it was cool. I mean, I'm still not very cool, but I thought it was then. But if you're relieving your carbon dioxide at the same rate that you're producing it, that would be considered normal respiration. But we do breathe much, much too shallow. Not just because we're very shallow people, which many of us are, but because we do chest breathing. We only breathe from the chest. We don't take the air deep enough. We don't take it down deep where our lungs have more surface area. When you look at a picture of the lungs, and the bottom part is much bigger. They taper to like a cone, right? And that upper part is much smaller. It's not as much tissue there to take in the oxygen. Just a few terms for respiration. You know, we talked about sleeping last week, so we mentioned sleep apnea. And apnea means the absence of regular breathing. It's when you're not breathing. There's also bradypnea, which isn't very common. That's when your breathing rate is much slower than normal, below that 12 breaths per minute. So sometimes this might happen with certain drugs, certain depressant drugs. Dyspnea is something you've probably heard before. Shortness of breath. That's just when it's hard to get a breath in. Difficulty breathing. Eupnea, normal relaxed breathing, is what we want to be in all the time. There's hyperpnea, which is taking deeper breaths than usual, which can be okay when you're consciously taking deep breaths. But it might also be when you're hyperventilating, when you're breathing in really deep but fast. And much like Sonic, yes, we do breathe too quickly. And what does this mean for us? What does it do to us? Well, often it's a sign of a lung disease or disorder, say like asthma. It can also come from ketoacidosis, which is a normal thing that happens. It's a normal bodily process that can happen depending on your nutrition and activity. But prolonged ketoacidotic state can also cause you to breathe too rapidly. Allergies, of course, will also have an effect on your breathing that might make you breathe too fast. And we will have a full lesson on allergies later on in the year when we get into springtime. Naturally, anxiety, panic attacks can also cause us to breathe too quickly. And Rao, you like ketoacidosis, but not so much the diabetic ketoacidosis. Indeed, yes. And in fact, prolonged chronic rapid breathing does make it more likely that you might develop diabetes. And I'll mention why a little later. Any kind of cardiac issue can also lead to breathing problems. And yes, safecracker, smoking. But there are some other things that you can do or that influence your breathing, and that's posture. We'll talk about posture. Pollution and our exposure to toxins definitely can impact our breathing health. And unfortunately, may become more and more of an issue as time goes on. And look at that, hydration. Poor hydration can also lead to rapid shallow breathing. And a big one that affects just about everything else, sedentarism. Sitting around too much, not moving as much as we should. Prolonged sitting, prolonged inactivity. And stress. Something I think all of us can relate to. And Bit Shepherd says, I'm in this picture and I don't like it. Yeah, I think this is one of those pictures. It's like when you take a picture of the globe and you're like, everyone who's ever lived is on that globe. I'm in this picture and I don't like it. Many of these lead to vicious cycles. They feed into each other. Like, say, anxiety and panic. When you have frequent anxiety, you breathe very quickly, becomes chronic, and since breathing very quickly, chronically, can make you more likely to be anxious, you're more anxious more often, which causes you to breathe too fast, too often, which causes you to be more anxious more often. Sedentarism is very much the same. We don't get much movement, our lung health decreases. It's harder for us to be more active, which decreases our lung health, which makes it harder to be more active. Smoking does the same. Smoking hurts our lung health, which causes us to be more stressed. What do people do who smoke when they're feeling stressed? They light one up. They have another cig. That stress feeds into all of them, and we become stuck in this vicious cycle. And And what are the consequences? What happens to us because we breathe too quickly and too shallow in the world today? It increases our risks of a lot of problems. And there's a Pichu. There they are. Our rapid shallow breathing hurts our cognition. It hurts our memory. It makes it harder to remember things. Obviously, we are more frequently fatigued. But something not a lot of people think about is that our rapid shallow breathing makes it more likely that we'll get sick. We're more likely to catch disease and infection. And of course, that sedentarism we talked about, eating right back into our poor breathing health. And these three big ones, anxiety, depression, and isolation, are very severe consequences that we don't often think about when we talk about breathing health. But if we're more sick more often, and we're more anxious more often, and we're sitting around more often, we're more likely to experience anxiety. All of those things are more likely for us to experience depression. And these can cause us to isolate ourselves. And as we will hopefully be talking about in the coming weeks, when we talk about the crisis of social isolation in society today, we'll talk about what we can do about those things. Because it also impacts pretty much everything about our health. But the first thing we're going to touch on is anxiety, because I think most of us here can safely say this is something we can relate to, something that we've experienced ourselves. How does breathing play into it? Absolutely 2/3 Lotus. This can all come from our poor breathing habits. A lot of research supports that the fact that we breathe very rapidly and very shallow, it increases our anxiety. It activates our, as we on the screen there, our sympathetic nervous system, our fight or flight mechanism. And being in that constant state of vigilance increases your adrenaline and your cortisol, causes more inflation. You know, your heart rate is constantly faster than it needs to be. It's a very complex web, you know. It's like sleep we talked about last week. If you're chronically getting a half hour, an hour less sleep than you should, it builds up pretty quickly. Poor sleep leads to poor cognition, poor judgment, more risk of anxiety and depression. This hyperventilation that we are constantly experiencing, it affects our amygdala, say an important part of our brain. And if you had to guess what the amygdala affects that's relevant to all this, what would you say? Well, the amygdala is responsible for processing fear, among a lot of other things. Emotion, yes. Our high emotional states. And when we're overbreathing, the amygdala has difficulty regulating our fear processes, so we are more anxious. Anxiety is really, it's talked about a lot. We think about it a lot. We talk about treatments all the time. People, you know, we take medications, and that's good. We should if we need to. But we don't talk about how that frequent anxiety affects all of our other emotional states. But of course, we got to mention smoking. I shouldn't have to tell you much about smoking. We do have a whole lesson on nicotine. We have a whole lesson on nicotine that we will get to in our drugs and alcohol unit. Ooh, very good point. Very good point. When we look back on our past, Mantle Merchant, there was some discussion, some social media discussion about how people don't really understand how fear impacts our memory. You know, when we shut out memories because we're feeling fear, we're experiencing fear. People who are, you know, suffer from PTSD may have memory gaps. It's because of these areas of our brain being impacted. They're all connected to our memory centers as well. I shouldn't need to tell you a whole lot about smoking. You've seen all kinds of stuff like this before, so we won't spend a whole lot of time hammering away at it. A healthy lung versus a smoker's lung. And you've probably heard that every cigarette shortens your life by 20 minutes or so. Wonder how many minutes off of Bobby Hill's life this was. Bobby. So if you do smoke, please try to cut down. Please try to quit. Because when you quit smoking, within 20 minutes, your blood pressure and your heart rate start dropping. Within 1 month, the feelings of shortness of breath, coughing start to dissipate. Within 5 years of quitting smoking, your risk of issues like stroke, they're back to normal. And if you can stay off of cigarettes for 10 years, you can cut your risk of lung cancer in half. Zuzu Bunny, welcome. First time chatter. Carbon dioxide also causes your heart rate to rise. Absolutely. Yes. So not just increases in anxiety, as Zuzu points out, but it makes existing anxiety worse. It can exacerbate existing problems. And welcome, Shadows of Saber. Great to have you here with us as well. Mantle, you're studying to become a doctor. Psychology is your big interest. This is a big intersection of those two. How our breathing health, how our lung health, our respiratory fitness impacts our mental states. You know, and as someone who is... Oh, Pat the Badger. Pat the Badger has made an appearance. Thank you, Bit Shepherd. As someone who is into fitness instruction as well as health, we've got to talk about sedentarism. It's a two-way street when it comes to our lung health and our mental health. In both physical and mental. When we are too sedentary, when we are not moving around much, our lung capacity begins to dissipate, begins to fade. Muscles become weaker because the lower oxygen decreases our energy, and it can lead to changes in our metabolism. Sedentarism. So sedentary is not moving around much, being inactive. So lack of physical activity plays a huge role in this. And with most of these things, like we've been saying, it's a cycle. We're not very active, so we have reduced lung capacity. We have reduced lung capacity, so we don't feel like being very active. It becomes a vicious cycle that we get stuck in. And for mental health, that sitting around too much leads to higher cortisol, the stress hormone. And that lower oxygen impacts our focus. Pretty strong research about how much it impacts our concentration, our memory, like we just talked about, and our mood. But you can break the cycle, and we'll talk a little bit more in a sec, but you don't have to do a lot to get going. You can start low intensity and just do movement breaks. Like we do every hour. We take 3 minutes every hour to move away from the computer, to stretch out a little bit at least, to use the restroom, get a drink of water, get a snack, do something except for staring at a screen, uninterrupted for hours at a time. We can break that cycle. We can break that chain. But like I said, movement break can be enough just to get you going. Stretching out. We've talked about yoga before. Talked about doing some light Tai Chi. It's also good when you're getting going with these activities to think about your breathing. Consciously think about how deep and how slowly you're breathing. But there's one other thing I want to touch on that I think most of us also have struggled with at times. Posture. And trying to do a little bit more sitting up straight. Because we know the phone does this to our neck, right? And for every couple of degrees that we're leaning forward regularly, the amount of pressure on the back of our neck increases severely. 60 pounds of pressure at the normal view angle. But, you know, we talk about posture a lot, especially people who spend a lot of time on the internet. And we know that we should improve it. But you don't really hear too often about how much it affects your breathing. But it does. This constant hunching over and our rolled shoulders forward, it compresses the lungs. And it makes it harder for the respiratory muscles. The muscles in and around our chest and on our sides, it makes it more difficult for them to breathe. So we have a pretty good understanding of how important these issues are. And, you know, I was relatively healthy. I know I was a fit, healthy, relatively young person in my 30s, and yet COVID did not discriminate and still gave me blood clots. Something we should also keep in mind, that things can happen to anybody. A little bit off topic, but always understand that disability can happen to anyone, and we should always be advocating for accommodation and accessibility, because it can be yourself, it can be someone you care about. Yes, the constant bad posture we have compresses our lungs, makes it harder for our muscles to get a good breath of air. And then when we're getting less oxygen, we feel more fatigued, so we're less likely to maintain good posture. Yet another vicious cycle. So let's do a little posture check. If you thought we were going to do this, you guessed right. We're going to do a little bit of a posture check in our seated position. So, if you can, get your feet flat on the floor. Tuck your chin a little bit. Not all the way down to your chest. And I will put up a quick little video so you can see exactly what we're talking about. Move your head back. Lower those shoulders back and away. Pinch them just like this. Seated, nice and relaxed, feet flat on the floor. Chin tucked a little bit. Head back and roll the shoulders back. Show from the side. Feet flat. Chin tucked a little bit. Not exaggerated though. See the shoulders roll back. That is me. That is actually myself. In my Barbie shirt that I got for $1.99 on clearance. If you're standing, if you're at a standing desk or something, there's one for you here as well. With the steps of this one being, have your feet about the width of your hips. Line up your knees over your ankles so you're not bending too far forward or locked. Your pelvis neutral, and then tuck your chin and head back with your shoulders slightly pinching backwards. And there's one of the ferrets getting in the shot, as always. Feet neutral, pelvis neutral. Yes, my Barbie shirt and my Powerpuff Girls mask. Because your lungs aren't quite like balloons. That's the analogy a lot of people make. They think of them like balloons, but it's not quite like that. They are springy. It's a little bit more like a slinky. They have what we call elastic recoil. So that if you take in a nice full breath like we're talking about doing, it's easier for your lungs then to get that air all out and have a nice full exhale. The exhale is something a lot of people don't think about as important. Because if you don't get a good exhale, you have stale air stuck in there. Now, thank you for enrolling in our little classroom here, Satira Corner. Thank you. If you don't get a full exhale, it's harder for you to get that next breath in. There's still some air in the lungs. We're already naturally losing some of that springiness, that elasticity as we grow older. So our poor breathing habits make that happen even faster and make it more likely to develop asthma. And what's characteristic of a lot of asthma cases is difficulty getting the air out. And then you're stuck with that high level of CO2, which, like we talked about at the start, leads to greater levels of anxiety, more likelihood to experience panic attacks. And as the research has started to show, can lead to increased risk of diabetes, increased risk of depression. Yeah, and Bit Shepherd's exactly right. Our teacher's aid showing there, we have a whole playlist of all of our previous lessons. Most recently, we talked about sleep. Yeah, your lungs are more like a spring. You want to have them expand and contract with a full recoil. Doing this improves your breathing efficiency, makes your lungs stronger, keeps you from losing that elasticity over time. Because if you have a big loss of elasticity, it's going to decrease your quality of life, especially as you get older. You can also develop stiffness in those tissues, characteristic of things like emphysema and COPD. So, what are we going to do? We're going to stop. We're going to stop ourselves every now and then. We're going to catch ourselves. We're going to catch ourselves when we're breathing too fast. No, we're not going to stop breathing, except when we're holding a breath during our breathing exercises. We want to catch ourselves. That's a good point. Aniki, stretch your ribs and your sides. It's like when we talked about self-talk, right? We had a lesson on self-talk. We want to catch ourselves when we have negative self-talk, when we are thinking negatively about ourselves. We want to catch it and confront that thought. If you catch yourself breathing quickly, not breathing very deep, then you can stop, take a break, do an exercise, do one of these breathing exercises we're going to go over. And how will you know? How will you actually do it? Well, if you think about it, it's like when we talked about dreaming. You know, you want to remember your dreams? Just consciously think about, I want to remember my dreams. Consciously think about, I want to catch myself when I'm breathing too quickly. Give yourself conscious reminders. And do periodic checks. And when you catch yourself doing that, do one of our breathing exercises. Schedule them out. Plan, say, right when you wake up or right before you go to bed, to do one of these exercises. And if you do them in a planned manner, say once in the morning and once at night, then it's more likely that you will pay attention throughout the day and catch yourself, say, sometime during that day when you are breathing too quickly. So we were talking about doing our breathing exercises, so let's go over our first one. We're going to do 4 different types of breathing exercises. And the first one that we're going to do is a simple slowdown. This is called paced breathing. This is the simplest one we'll do. It's just regular, in and out, but at a particular pace. This is one you can do standing. And it's shown to reduce blood pressure and reduce anxiety, and also to improve sleep. So how we do this exercise is standing or seated, but maintaining your good posture. I want you to focus on a spot in front of you. And once you're comfortable and in good posture, relaxed, focused on one spot, you take just one normal breath. Just one regular, normal breath at your normal pace. And then you're going to breathe in through your nose for 3 to 4 seconds. And then exhale through the mouth for 4 to 5 seconds, pursing your lips, making a swoosh sound. So it would be like in, that swoosh out sound. And you see the graphic on the screen there to help you follow along. So in the white, it would be in, 2, 3, out, 2, 3, 4. So we're going to do 3 breaths like this together. And I will tell you when we'll start formally. So next time. Ready, and in, 2, 3, out, 2, 3, 4, in, 2, 3, out, 2, 3, 4, in, 2, 3, out, 2, 3, 4. Very good. So that's very simple. That's a simple paced breathing exercise. Now, if you want to do that as an exercise, you do that for 6 breaths. 6 cycles of that in and out, in through the nose, out through the mouth, that whoosh sound, staring at one spot on the wall. That's the first of our 4 breathing exercises that we'll do. A very simple way to slow down when you catch yourself breathing too quickly. The next one is alternate nostril breathing. This one is shown to have good impact on your cardiopulmonary health, so your heart and lungs. And that in turn has an effect on your brain function. This is a popular type of exercise in pranayama. So it is a yogic practice as well. There is good research behind this one for improving your cardiopulmonary health. So there's a little bit more involved on this one. It's a little bit more to do. So here are the steps. You want to sit comfortably. Do you want to be seated for this one? Then relax. Get comfy in your chair. Some of the people who practice this say that you should also smile a little bit when you do it. Put a little smile on your face as you're sitting comfortably there, relaxed. And then you take your thumb and your finger and put them on your nostrils. Just touch them lightly. One thumb on one nostril, one finger on the other, like you're about to pinch your nose. And once you're ready, you'll close the left nostril and take a 3-second breath in through the other nostril. Then you switch and close the right nostril and breathe out through the left nostril. While still holding that right nostril closed, take a breath in through the left and then switch again. So like this, you see this diagram here, this GIF showing us how to do it. In through one nostril, out through the other. In through that same nostril, out through the other. So let's do that together. Get yourself ready, comfortably, relaxed in your chair. Put a thumb and finger on your nostrils, and I will let you know. I will count us down. We'll do 3 cycles of this. Oh, wow, yes. You can also just press the nostril close if you want, if you're sensitive to that and don't want to sneeze. So I will count us down, and we will do it. Pinch off one side, breathe in through the other, and then swap 3 times. 3, 2, 1, in and out and in and out and in and out and in and out. One more. In and out. Very good. So that is something you would also do. You want to incorporate this into your breathing health. You want to do this alternate nostril breathing. You would do 6 of these. Why not just do some cardio? You can do cardio too, and you should. But you also want to improve your resting breathing. Alternate nostril breathing has good research showing its improvement in your lung function. We'll grab one of these. I will put a link to some of these studies in here too. The third exercise we're going to do, the third of our 4 exercises, is the classic box breathing that you may have heard of, you may have seen people do before. It's a bit of a cliche because it does work in lowering cortisol and increasing attention, increasing focus. So a lot of soldiers use this, people in high-stress jobs, doctors and nurses, athletes will utilize box breathing. Might be called 4x4 breathing, or 4 squared breathing, or square breathing. It's called that because you breathe in through the nose for 4 seconds, hold it for 4 seconds, breathe out through the mouth for 4 seconds, and then hold again for 4 seconds. So it's 4 squares. So good for your attention and focus, reducing your cortisol, and lowering your anxiety. But we're going to do this exercise together. So sit comfortably, get relaxed, have your back nice and flat against the chair. And then I'll count us down. We're going to breathe in through our nose, hold, and exhale through our mouth, and hold again at the bottom for 4 seconds, and then start over. We're going to do this. We'll do the full cycle. We just did 3 for each of the others because we want to make sure we don't take up too much of your time, but we're going to do 6 full breaths like this. So the next time the little GIF comes around, we're going to do it. Ready? And breathe in. 2, 3, 4, hold. 2, 3, 4, exhale. All the way out. Hold it. 2, 3, 4, breathe in. 2, 3, 4, hold it. And exhale. And hold it. Inhale. Hold it. And exhale. And hold. And inhale. Hold it there. And exhale. And hold it. One more. Inhale. Hold. Exhale all the way out. And hold it. And that's it. There you go. Breathe normally. So that is 6 box breathing breaths. Excellent exercise. A lot of people do. And we've got one more, our 4th of our 4 breathing exercises. And that is one that we always do before we start every lesson. Except for this one, since this is the lesson. We always do this 4-7-8 breathing exercise. It's diaphragmatic breathing. See the diaphragm there? That muscle at the base of your lungs. Right there in your abdomen. The bottom of your torso. We want to pull the air down deep. We want to get the air all the way down into the base of the lungs where we have all that surface area to absorb the oxygen. And it gives us more time to get rid of all of the carbon dioxide. We want to get rid of all that stale air from the bottom. So for this exercise, again, sit up straight, nice and comfortable. Unclench your jaw, relax yourself. Roll your shoulders back a little bit. And get your feet flat on the floor. And then I want you to take one hand, or paw or claw, or whatever it is that you have on the bottom of your lungs, or the bottom of your limbs, and put it over your chest. Because we don't want to breathe from our chest. We want to breathe from our abdomen. So we're going to take that other hand, or paw, or claw, or whatever, and put it over our abdomen so that we can feel the abdomen rise and fall. Make sure that we're pulling that oxygen down deep. We're going to breathe in through our nose. Hold it gently. And then exhale all the way out through our pursed lips. You have a hand on the bottom of your lungs, Dragon. Goodness. So it's inhale for 4 seconds. Hold it for 7 seconds. And then exhale for 8 seconds. So we have a diagram here as well. So when this pink ball gets to the top, we're going to start. All right, get ready and breathe in. 2, 3, 4, hold it. And exhale slowly but surely all the way out. Complete exhale. Empty your lungs. One more, breathe in. And hold it. And exhale. Nice and slow. And breathe in. And hold it. And exhale. Really slowing things down. And breathe in. And hold it there. Exhale. And breathe in. Hold it. And exhale. And there you go. Very good. Resume normal breathing. Yes, indeed, Rao. One of our favorite exercises. Fantastic breathing exercise. Really good for lowering your blood pressure and heart rate. There's some research suggesting that the longer exhale period can be beneficial because, we hold all that stale air so often. Holding with a lung full of air, really make sure you're extracting as much of the oxygen as possible out of each breath. Yes, indeed, you can join us in the Discord. Rao, you say you got your pulse down to about 55 doing this before your surgery last week. Wow, what a difference, because that's a pretty significant drop, but a very good low heart rate. Yes, indeed. So those are our 4 breathing exercises. Paced breathing, alternate nostril breathing, box breathing, and diaphragmatic breathing. There is still other things we can do, though, to improve our lung health and our breathing. You can do more than what we've been talking about so far. There's still more. There are some nutritional things that we can do. The Western diet, as we've probably heard quite a bit, it's high in grains. We have a lot of cereal type products, a lot of grain, pasta, and a diet high in grain and fats, especially saturated fats, is associated with an increased risk of asthma and exacerbating asthma. Also associated with a higher COPD risk. So we may want to cut down on our grains and eat more fruits and vegetables. Wow, isn't that a surprise? Are you shocked? Are you shocked that fruit and vegetable consumption is associated with a lower long-term risk of lung issues? Probably not. You're probably not surprised by that. A lot of people also ask about supplements. Given my previous background, a lot of people ask me about nutrition and supplements. We have a whole lesson about supplements that we will bring around again in a upcoming unit. You eat your spinach, Cyrus? Yes, it's very good. Your spinach is very good. Leafy greens, full of vitamin E. But when it comes to supplements, most things don't do a whole lot. Fish oil is associated with lower risk of developing lung issues, possibly by reducing inflammation. Vitamin C, but that's natural given what we just talked about, increasing our fruit and vegetable consumption. There is some conflicting evidence about supplemental vitamin C. It may improve our lung health, may improve asthma symptoms, but the evidence isn't quite there yet. It still needs more research. The studies currently are equivocal. Vitamin E does have good evidence for its effect on asthma risk, and asthma severity, but not supplementary. That is, a diet high in vitamin E seems to be associated with lower risk of lung issues. But there hasn't really been evidence of taking it in a supplement. Now, why would a diet that is high in a vitamin be better than that same amount of a vitamin through supplements? Well, there are other things in those foods. Those types of diets also tend to have higher rates of other nutrients, so it may be that those nutrients in combination are more important than taking them supplementary. But there's one other thing that we should talk about nutritionally or supplementary for lung health. Hydration. Hydration actually plays a big factor in your lung health. Because when your lungs are dehydrated, they don't function as well. The mucus in your respiratory system is thickened, and you're more susceptible to infection. And repeated infections in your lungs make it more likely that you will develop long-term lung issues. So, make sure that you are getting plenty of hydration. It will actually play a role in your breathing health. I do have some homework for you. We've gotten through all of the information in the lesson, but there's homework. I don't like to give a lot of homework. I try to avoid it in teaching. I don't think it's that beneficial. But this homework, oh yeah, there you go. There we go. There's the hydration. I knew it was coming. Yes, stay hydrated. Thank you. Thank you, Alpha. But for our class, we do practical stuff. So our homework is practical. So your homework is to incorporate one of these breathing practices. Incorporate one of our breathing exercises into your daily routine. Perform it each day between now and the next time we see each other, in our next lesson, or in our next stream, probably next Wednesday. And come back and tell us about how it went, how it made you feel. If it did help you reduce your heart rate, your blood pressure, make you feel less anxious, or helped you sleep better. So that's your task between now and the next time we see each other, either next Wednesday or next Saturday when we have our next lesson. Because remember, all this rapid, shallow breathing that we do leads to a host of issues that all feed into each other. But there's things we can do about it. We can work on our posture. We can move a little bit more, drink more water, eat more fruits and vegetables, and of course, do our breathing exercises. But we also want to leave a little time for discussion, so let's talk a bit. What do you think about all this? You know, in our lesson on sleep health last week, I had a screen up and I made a statement that might have been, I don't know, to some people might seem controversial. I said that our poor sleep habits should be considered a public health emergency. Because sleep affects so much, because it impacts depression levels, anxiety, our judgment, memory and cognition, our concentration, how many accidents there are because of tired drivers, how much lost productivity there is. I said we should be considering poor sleep a public health emergency. What about the things associated with breathing? You think that might be similar? I also intentionally left one thing out of this lesson. I left one issue that affects some of these issues, other issues, out. Something that relates to, our high anxiety and why we are so prone to breathing rapidly and shallow. And I'm wondering, because I didn't leave any hints, what you think that is. It is something we've talked about in the past in previous lessons. What do you think might be related to why we breathe so fast, why we breathe so shallow, and thus why we have so many of these issues? Rao suggests poor air quality. That's a good one. Pollutants, our environmental issues. A lot of places dealing with wildfires and smoke. There are a lot of chemicals in the air. There's a lot of PCBs in my area. A lot of forever chemicals, they call them, that may be impacting our breathing health. That's one possibility. What's another public or socio-cultural thing in the world today that might lead us to breathing more rapid and shallow? And Safecracker, you say sleep is a choice, breathing is a choice, drug use is a choice. Yep. I mean, drunk driving is definitely a public health emergency. Cyrus makes a great point about constant increases in productivity, the demands to constantly be productive. We always have to be doing something that's productive, that's advancing our own interests. Yes, hustle culture, as Rao puts it. Very costly to our mental and physical health, yes. Interesting how this all ties together, isn't it? So many of the subjects we've taught. We've given lessons on supplements, and how people turn to supplements so often because we are feeling pressured to improve our health, but we don't feel like we have time. We've done nutrition and how difficult it is with our finances to eat healthier food or have the time to make healthier food. Yeah, a lot of our lessons tend to tie together. But the thing that I didn't include in this one is technology. We didn't talk about our screen use. We didn't talk about, we mentioned posture. We didn't talk about overstimulation or the stress of social media. It's another aspect that can lead us to breathe more rapid and shallow because we're constantly overstimulated. A lot of different things all tie into this. And if we practice better breathing, if we improve our breathing health, if we catch ourselves when we're breathing too quickly, slow down, take a few deep breaths. During that sleep health lesson, I don't know if we commented on it last time or if it was the first time in our first year when we did the lesson. We talked about how there's a saying, sleep on it. When you're faced with a decision, you tell someone, I'll sleep on it, or you tell them to sleep on it. And how that's not just a saying, that if you get a good night's rest, you'll think more clearly, and you're more likely to make a good decision. We talked about how being tired, not getting enough sleep, makes you make poor decisions. It hurts your judgment. Well, we don't make very good decisions when we're chronically stressed. So if you take a few moments out of your day to do a breathing exercise, bring your heart rate down, bring your blood pressure down, bring your anxiety down. You'll make better choices. And just like if you're about to make any big decision, you should sleep on it first. I think you should also take a minute or two to do a breathing exercise before you make any choices. About anything, really. It can help. Well, what are you going to have for dinner? Take 2 minutes and breathe. Take a couple deep breaths and think about it. But that's all I have for you for our lesson today. But this is your certificate of completion for completing our breathing health lesson, signed this day, January 25th, 2025, and I will get you your certificate if you want in the Discord. Thank you so much for watching this lesson. I hope you learned something useful and that you can apply it to improve your quality of life. If you liked what you saw, make sure to follow the channel and follow us on Twitch so you can join our lessons and games live. On the screen, you'll see links to our channel and our playlist of other lessons. Thank you again for watching and for supporting independent streaming and educational content. I hope to see you next time. Class dismissed.